Okay, so I'm going to pick up with some of the leadership and organization breakdown of the Department of Health and Human Services. So kind of on the left side, you'll see the list there of the key players that we're going to discuss a little bit here, some of what they do, and a little bit about them as well. You have at the head of the department, Secretary Sylvia Burwell. She's worked quite a bit. She was in charge of Walmart for a while. She worked at the Bill Gates Foundation. Pretty impressive resume. She worked for the Clinton administration as well, and now works for the Obama administration. She was sworn into office a couple years ago, June of 2014. And she got her education at Harvard and Oxford University. Directly under her, you have the Deputy Secretary, Mary Kay Wakefield. And she oversees all operations within the department, including Medicare and Medicaid, public health, medical research, food and drug safety, welfare, child and family services, disease prevention, Indian health, and mental health services. Then we have, kind of breaking it down further, we have the Acting Assistant Secretary for Administration, Colleen Barros, and she's responsible for leadership management for the department, human resources, equal employment, opportunity compliance and operations, IT, business transformation, and security and strategy. Then you have on the right side Ellen Murray, who's the Secretary for Financial Resources, and basically she is in charge of advising the Secretary on all aspects of financial stuff, so budget, anything to do with that, acquisition management, and then how to carry out all those plans. Then you have the Inspector General, which is Daniel Levinson, and he basically serves as a liaison to the Secretary and Deputy Secretary to review all existing and proposed regulations and legislation, which kind of goes hand in hand with the Acting General Counsel, who's basically the lawyer for Health and Human Services that oversees and advises the Secretary on any type of legal matters that involve the Office of the Secretary of Health and Human Services. Then you have Jocelyn Samuels, who's the Director of the Office for Civil Rights, or the OCR, and she enforces federal laws that help ensure non-discrimination, equality, and anything that's federally funded as far as health and human services go. And then she also takes care of enforcement of federal law that protect the privacy and security of medical information, like HIPAA, and your rights to your medical information. Then you have Karen DeSalvo, who's currently the Acting Assistant Secretary for Health, and she's also in charge of information technology. And so the Office of the Assistant Secretary for Health oversees 12 additional public health offices, including Surgeon General, the Public Health Service Commission Corps, as well as 10 regional health offices across the nation, and 10 presidential and secretarial advisory committees. Then you have Jim Kolker, who's the ASGA, the Assistant Secretary for Global Affairs, and it's pretty much what it sounds like. He is in charge of promoting well-being of Americans and world populations throughout the world, obviously, since they're world populations, and form strategic partnerships with other government agencies. We have Nancy Griswold. She's the Chief Administrative Law Judge for the Office of Medicare Hearings and Appeals, or the OMHA. And she oversees third-level review for Medicare appeals within the U.S. and within the Department of Health and Human Services. And she has responsibility for the second largest administrative law judge corps in the federal system. So pretty huge legal responsibility on her shoulders there. And then we'll wrap it up with the ASPA, the Assistant Secretary for Public Affairs, Kevin Griffiths. And obviously this is one of the key players as well. He serves as the Secretary's Principal Counsel on Public Affairs. The Office of Assistant Secretary for Public Affairs conducts national public affairs programs, provides centralized leadership and guidance for staff and operating divisions, regional offices, and handles digital communications and administers the Freedom of Information and Privacy Acts. Also leads the planning, development, and implementation of emergency incident communication strategies and activities for the department. Just a quick tip, when I was going through all this information, it's kind of easy to just look at each role and each individual secretary and think that's the person and that's their job. But each one of them is heads their own department and has people working under them, and there's layers and layers of leadership and management in the Department of Health and Human Services, just like any other organization. So that kind of helped me to understand how much goes into each one of their jobs as well.